What's up, guys? Nurse Jeremy back again. So last time, my first video that I made, uh, I was kind of just waiting to go through the treatment. We hit a couple of snags where I was supposed to get my treatment done on Monday. There was an issue at the hospital, and the pharmacy didn't get the order. So I actually checked in to the hospital. They told me to get there as early as possible. I dropped my little boy off at daycare. My wife and I took our ride to the hospital after that, and we checked in about 9 a.m. And they told us, well, 9 a.m. is pretty soon. The pharmacy takes a while to mix the meds. And of course, they only want to mix them once someone gets there, because it's no good if they mix it and then they have to wait a certain amount of time because I got stuck in traffic or something like that. So they only mix it once you get there. So once we got there at 9, they told us we'll probably start around 1, which a little unexpected, but fine. And probably around 10 o'clock, the charge nurse came in and she said, I got some bad news. The order, for some reason, wasn't placed in the proper way, and the pharmacy never got the order. So unfortunately, we can't do treatment today. But you can stay for the night. Again, my insurance actually pays better for the treatment if I do stay the night. So that was kind of the game plan all along. So now the plan became stay the night and start treatment as early as possible. So a little frustrating. Originally, I was supposed to get my treatment on Friday, and because I changed it from outpatient to inpatient, that delayed, which there wasn't supposed to be a delay, but it happened, and then delayed again because the pharmacy didn't get the order in. So now I had to wait. Yesterday was Monday, so I waited till today. I slept there by myself. My wife came home to watch the little one. I slept well. I really have been feeling really good about the diagnosis. My doctor came in to talk to me probably about 8 o'clock in the morning. He still says the same thing. He likes what he thinks will happen. Of course, he can't guarantee anything, which, it's from a patient standpoint, it's hard to hear that they can't guarantee, because what they can't guarantee is that you might not do good. So that's scary to hear. I always looking for some reassurance, and of course, you want a doctor that's going to be honest, and it's that honesty that doesn't give you the reassurance that at least I look for when talking about the treatment. And I mean, you're literally talking about life here, So it can be a bit scary, overwhelming. But I really like the doctor, and there's so many people that talk very, very well of him. Um, so that also makes me feel good about chatting with him. Now, with that said, I've been having a folder that they gave me since the diagnosis, and they give in the folder the treatment information. So this is it's going to be backwards because I'm on selfie mode, but the treatment's called ABVD, and that is an acronym for the 4 medications that I get in my treatments. I think there's a 5th one that they use on the very first treatment, and I'm not going to be able to tell you which one's which. But yeah, ABVD is adriamycin, bleomycin, vinblastine, and dacarbazine. Now, another crazy thing about chemo is the side effects. And I'll just go over the common side effects, and this is specific to this treatment. It's not specific to every treatment. Of course, they all vary. They all vary and have different side effects. So the common side effects, they said you could almost guarantee that these may happen, and this is what you kind of have to prepare yourself for after treatment and the care that you need to take of yourself and your loved ones. So, common side effects: decreased white blood cells and increase of risk of infection. So, obviously, decrease in white blood cells is going to put you at risk for more infections. So, one of the things that they've been drilling me right now is if you have a fever 100.4, you got to go to the doctor. You got to go to the hospital. Call the doctor, let him know that you're running a fever, and he's probably going to tell you, go on over to the hospital. So, obvious, and well, I'm not going to say obvious because not everybody's going to know. If you have a fever and you have no way of your body protecting you from whatever's causing the fever, most likely an infection. Now your protection, your white blood cells aren't there to protect you from whatever infections invading your body. So you have to go to the hospital, and they'll probably give you IV something, medications, probably give you an infusion that will help bump up your white blood cells, and depending on how bad, if you have an infection, on how aggressive they're going to be to treat this. Second is fatigue, anemia, which is caused from decreased red blood cells. So your red blood cells carry your oxygen. Oxygen is going to help oxygenate your tissues, and then therefore giving you energy. If you're low on red blood cells, you're considered anemic, and you're not going to be getting that oxygen to your tissues. It's going to cause you to be tired. Decreased platelets, which is an increase of bleeding. So your platelets is what coagulates your blood. Platelets are imperative to stopping you from bleeding, whether it be just a nick or, God forbid, something way worse. You have to be very, very careful when it comes to anything that you might be doing that could cause you to bleed. And I mean, something as simple as yard work. I mean, you could be cutting the grass, weed eating. These things, like just a freak accident that could happen. You don't know. We never know what a freak accident is going to happen. So it's just one of the things that you got to be very careful of. No contact sports for those people that want to play or love to play. You may need to limit yourself to something else. So you're probably going to bruise much easier. But also playing sports and having anemia, that's probably not going to ride very well either. You're going to be tired. There's more on here than I thought. Nausea and vomiting. I think that's a given. That's what every person, every professional that I talk to, when you're getting chemo, you're going to be nauseous. Anorexia, loss of appetite. I can already tell you, I got my first dose today, started at noon, ended at 4, and right around 4 o'clock, I started feeling nauseous. They gave me a lot of medication, different medications for nausea. But I really feel like my nausea actually stemmed from, I just had a really, really, and I still do have a very full feeling in my stomach. It feels like I ate like a large dinner just a little while ago, but I ate probably around 6 p.m. I just feel very full right now. Um, that's something that they'll say for nausea. Eat small, frequent meals and bland, because spices are going to cause you to be nauseous, I guess. And I'm starting to realize, like in real time right now, what chemo brain is. I'm my mind's cloudy when it comes to trying to just think of simple words right now. Bland foods like bananas, rice, applesauce, and toast. Do not eat fried, spicy, or fatty foods, and drink plenty of liquids all day. Which brings me to another point, that something else that I'm experiencing right now is dry mouth. And it was dry before I started talking. I've been trying to drink as much as possible, and that might yet be another reason why I'm feeling full, because I'm trying to drink as much water as possible. With that said, constipation is very common also. Um, Drink plenty of fluids, helps loosen your bowels. Drink warm, hot liquids. If you do not have mouth sores, which the next one on the list is mouth sores and pain. One of the reasons why you get mouth sores and pain is the constant dryness of your mouth. And with that, I've also read, it's not on here, but it affects your teeth. I work with a girl who had chemo, and actually she said some of her teeth fell out. And I would assume that she probably had poor oral care. Um, Before I started my treatment, I reached out to my dentist and asked, like, hey, I know someone whose teeth fell out after or during her chemo treatment. What can I do to prevent that? And one of the things she said, drink as much as possible. If you don't feel like drinking, then buy a spray bottle and just spray your mouth. There are mouthwashes out there that coat the mouth really good and trying to keep moisture in there. I don't have the names of those, but I'm sure there's something that you can Google for it, or even ask your dentist. And brushing teeth more frequently, maybe brushing teeth instead of morning and night, you brush 4 times a day, twice throughout the day. Um, Rash, itchy skin, and other skin changes do not stay in the heat for long periods of time. Use creams and moisturizers often try wearing cotton gloves. Do not use perfume, cologne, or aftershave. These products can irritate the skin. Try to stay out of direct sunlight and do not use tanning beds. Wear protective clothing, hats, sunglasses, and sunscreen with SPF of 30 or higher when outside during. And then the big one for a lot of people is hair loss, alopecia. Um, and something that I am trying, that I was told to do to help with the hair loss, and actually neuropathy, it's supposed to help. It's called cold capping, where you could buy these silicone bags, basically the same silicone bags that you throw in the freezer, and put on sore joints or anything that you need to just help with cold therapy. But this one is in the form of kind of a hat, or like a helmet, kind of, because it goes over the entire head and goes over the ears. So I brought that with me for my treatment, and I also got cold gloves and cold socks. That's supposed to help with the neuropathy. So the idea behind it is that you're going to constrict those vessels that are going to the hair follicles and going throughout the hands, by minimizing the amount of chemotherapy that's going to reach those tissues, because the vessels are smaller. Therefore, these tissues do not get the same amount of chemo that they would had you not put the cold therapy on it. Um, does it work? I am not sure, but I also figure it's worth a try. So I'm doing it. Um, Then, my medications, oral nausea medications. Some of the ones that they started me on. Now, they gave me some other stuff at the hospital today. And a lot of it they give pre-treatment, and then they gave me another one post-treatment. But we have dexamethasone, which is actually a steroid. I'm assuming, because usually dexamethasone is used for inflammation, but in this case, they're using it as anti-nausea medication. Olanzapine, another anti-nausea. This one I'm only supposed to take on days 1, 2, 3, and 4, and only take it at bedtime. And those are scheduled meds. And then I have medication as needed, which is Zofran, and that's non-drowsy. And then I got Phenergan, which is another drowsy. I'm not supposed to take the drowsy one with the other drowsy one that's scheduled. So I could take that one after day 4. And that's that. I never seem to write down what I want to talk about. I can tell you a little bit more about the treatment. It started at about 12. It ended at 4. The first medication they call the Red Devil. It's red. And I think it's cardiotoxic, where it could potentially hurt your heart in the way it functions. Which, before all this started, I did a cardiac test, where basically they test the function of not only my heart, but they do a pulmonary test also to check the function of my heart and my lungs to see if it's affected throughout this process. I'm also going to get another lab draw next week to see where my white blood cells are, in terms of how low are they getting, and do I need to start taking precautions. Right now, on the topic of precautions, so all of my bodily fluids are now considered toxic to people around me. So some of the precautions that we have to start taking is, if I'm sweating, and we have a 4-year-old, so it's kind of hard not to touch him, because he's always, hey, hold me, come with me, let's do this, can I sit in your lap? So there's, you touch a 4-year-old very, very frequently throughout the day, skin to skin, and that's something that we all have to get better at. It's just hard to try to care for a 4-year-old without touching them, right? So we're trying to lay down some rules for him to understand that he can't hold you, at least for the first 48 hours. So it does change. After the 48 hours, most of the drug is out of my system. Therefore, I can start interacting more with him at that point. But also within the 48 hours is bathrooms, bodily fluids. You void, you urinate into the toilet. Men, I'm being told that it's best to sit to pee because of the splashing. So if you sit down and pee, and also how I've kind of set up my bathroom. I'm the only one using our bedroom bathroom now. My wife is going to use the bathroom that my son uses. But and it's just in the first 48 hours, but you're supposed to flush twice. And what I've done, I've already put a box of gloves, what's it called? Chemo brain, wipes to wipe down the toilet, and also a mask, actually. So anything that might be coming out of the toilet, even though I closed the lid to flush, and you flush twice to make sure everything goes down, I'm still wearing a mask. And then after I flush twice, then I wipe the whole thing down. and I put it in a bag and I take it to the trash outside. Is that too much? I don't know, but I'm being very, very cautious of how I'm doing this. I don't want to endanger anybody that's in my house. And again, it's just for the first 48 hours after treatment. Now, I'm going to get at least 4 treatments right now. So I think, I'll get used to it we'll all get more used to it as we go. What else? I didn't write anything down. I think that's it right now. In terms of how I feel, I feel full. It's not really a nauseous feeling right now, but I just feel full. I'm told that the nausea will probably last for the first 3 days, and after that, the nausea still it should get better, but then is when the fatigue is going to set in, and that lasts from 4 to 6 to 7 days. Um, Next week, I'm better, and then I'll be okay for several days before I go get my second treatment. Um, wow, yeah, I think that's it. Thanks for watching. My first video, I went back and watched it, um, and I don't know, it was very boring to me. So I think my monotoneness, I think that might just be me. Um, I don't know, the first video seemed extra boring. It was almost an hour long. And I can't say that I'm awesome at doing these videos. Oh, and I'm sure Hakuna Matata means no worries. If you're religious, give your worries to God. That's what I'm learning. Because the more you stress about things, the harder it is for your body to recover. So you need to try and be as stress-free as possible. Tell your loved ones, tell your spouse, like save the drama, to after you're finished, because yeah, you just don't want to stress on it too much. So I got my Hakuna Matata shirt on, and when I walked into the hospital room this morning, when we walked in, um, I work at the same hospital where I'm getting treatment, but not on the same unit. There were some of my coworkers that were in the room, and they decorated it with smiley faces all over. It was the kindest gesture. I can't think of words to describe my appreciation of my amazing coworkers. And not only did they hang signs with smileys, but on every smiley, somebody from our unit wrote a really nice kind words, notes and whatnot, just to give me motivation throughout all of this. I got smiley slippers, smiley t-shirts, I got a smiley blanket, and a smiley pillow. And just amazing. If you have coworkers, family, I think it's so important for this support group. People that care for you and love you and show you love. Everybody shows love differently, but it feels so good for someone to show love. At least for me, I like to see stuff like that. That just makes me feel so good. So, and every nurse that walked in to for whatever reason they were walking in, their first reaction was like, "Whoa, look at all this on the wall." It's really, really nice. The nurse that took care of me, um, he did really good. I thought for a while there that he was really nervous because his hands shake every time he's doing anything with the IVs, like his hands are shaking. So I thought it was a nervous thing, but toward the end of the day, I feel like it might have just been his baseline, whatever reason his hands shake. because his voice didn't indicate that he was nervous. He was very good at educating me or what's going on, what we can expect. And he accessed my port for the first time. So this is my port. You can see that. Go this way. There it is. That's my port right here. And you can see our part right here. So they access it with what's called a Huber needle, Hurber, and it could be like, I think the one they did for me, mine was about an inch long. It's kind of hooked a little bit like this, and you could say like this is the port, it's about the size of a quarter, and the needle kind of goes in like a hook like this, and you could feel it pop into the port, which is an unusual feeling. The only pain is really when it goes through the skin, but actually, to me, and the same thing the nurse said, the IVs actually hurt more than a port, and I would agree with that. I think they can give lidocaine. They didn't offer. I asked, and they said, "Yeah, we don't do that." So I guess you're just telling me to toughen up. Plants, no live plants for germ reasons. There's so many precautions you have to take so you don't get an infection. And live plants is one of them. Crowds. I'm supposed to be going on a family vacation here in a few weeks after my second treatment. So I'm going to have to take a lot of precautions, probably do all of my interacting outside. When I'm closer to people, I want to be outside and not in the confinement of a house. I'll probably sleep. I don't know. I might sleep by myself. We'll see how it goes. But I hope this video is a little bit better. I got it to be a little bit shorter. The other one was very emotional for me. And usually I'm not a rambler, but maybe I am a rambler. I'm recording myself. And I'm trying not to take these videos too seriously. I'm not trying to be a YouTuber. At least I don't think I am. But with that said, I bought, see, I'll turn this around for you. A stand. Got a tripod. I got a selfie light. And actually, I have a mic right here too. So, yeah, I feel like I'm not going to be that guy, but I might just turn into that guy. I don't even know yet. It won't be intentional. Anyway, thanks again, guys, so much. Again, my name is Jeremy. I'm going to start calling myself Nurse Jeremy. If you guys have any questions, feel free to comment, and I'll get back and try and answer questions the best I can. If I don't know it, I can guarantee I get it because there's so many people that are educating me throughout all this process. And if you're going through it, man, if you don't have anybody, you can't find anybody, message me. I'll be glad to talk about whatever it is that you guys have on your mind, and maybe even get you some contact information for groups that are in your area that can help you with stuff like this, because it's super important. Don't be by yourself in a time like this. You need people to help you. That's all I got for y'all today. Appreciate it.